Congratulations, you have just had your dental surgery. We are going to go over the post-op instructions for that, some do's and don'ts, things to watch for, and everything that way. On the form that you will be given, you will see 3 phone numbers. One is our office phone number, and then we have Dr. Townsend and Dr. Mears' emergency cell phone numbers. If you have any questions or concerns during the course of your healing or after your surgery, you can feel free to call us either at the office or call or text Dr. Townsend or Dr. Mears. We will also send in a prescription for you. There will be an antibiotic, a steroid, and then sometimes there will be a mouth rinse. With that, we ask for no smoking, spitting, sucking on straws, or aggressive swishing for the next 72 hours after surgery. That being said, I just mentioned a mouth rinse, and you're probably thinking, how am I supposed to use this mouth rinse without swishing super hard? Just put it in your mouth, bob your head back and forth, and then you'll just let it fall out of your mouth, avoiding that aggressive swishing. Keep your tongue away from that surgical site for the next 3 weeks until we take stitches out, and then you're also going to want to avoid chewing on that site for the next 3 to 4 months while you heal. You're gonna wanna eat cool, soft foods for the next 24 hours. Avoid chips, nuts, things with small seeds, popcorn, anything that can poke your tissue, get stuck in the stitches, make that area angry. Some things to avoid: tobacco products, vaping products, alcohol, medicinal marijuana, carbonated beverages, very hot fluids, and commercial mouth rinses are the big ones there that people don't typically think about. The reason we ask for that, to avoid those for the next 72 hours, is because it can prolong your healing process and it can also disrupt the clotting, which we want to avoid. You can use a saltwater rinse 24 hours after surgery. There is also that prescription mouth rinse that we will prescribe to you. You can use one or the other or both together. There is the recipe here on this paper that you will receive, but it is also on our website. If you have a water pick, avoid that area where we were working completely. And then if you have an electrical toothbrush, brush as normal everywhere else, but once you get to that site, turn it off and manually brush gently around that site, doing your best to keep it clean. Don't overexert yourself for the next 72 hours. Avoid anything that's gonna cause your blood pressure to rise or putting your head below your heart. So no heavy lifting, like things that are heavier than a gallon of milk, for example, or using an inversion table, or running a marathon, doing hot yoga, things like that. You can use ice packs, go 15 minutes off, 15 minutes on for about an hour, and you can alternate sides and go from there. And the ice will just help keep inflammation and swelling down and keep that controlled. We have a pain regimen listed on this form as well that we will talk about further in the appointment. It is 600 milligrams of ibuprofen, Advil, or Motrin, and then 1,000 milligrams of acetaminophen or Tylenol, using them together. It seems like a lot of pills. It'll be about 5 pills, but you're only taking it for the next 3 to 5 days, every 6 to 8 hours as you need it. If after day 3 you are not in a lot of pain, you can lay off of that Tylenol, but stay on the ibuprofen for the next couple of days just to help with the inflammation and swelling. We will see you back here in office in 3 weeks. We'll take stitches out, evaluate healing, and make sure everything is looking good. If you have any questions, if something doesn't feel right, if you have any concerns that way, feel free to give us a call either here at the office or using one of those emergency cell phone numbers of the doctors, and we will answer any questions that you might have. Thank you for choosing us, and we're excited to be with you on your dental journey.